He writes, first, I know and believe that the idea of, quote, conversion therapy, end quote, is wrong, and in fact seems to have very painful results. However, if one's genetic makeup is only weakly connected to that attraction from a scientific perspective, why is it so harmful? Meaning, why is the conversion therapy so harmful? Is it just because the societal pull and acceptance is already so great that from their very real perspective they are identifying as LGBTQ and you can't change that? Second, I know we lump LGBTQ together as one, but are there differences? I would think that LG is a very different genetic reality than Q. Thank you once again, as this area is definitely a huge issue that many communities deal with. And more importantly, the more we know, the more we can sensitively support individuals in this situation. So he's opening up the heart of the issue. And he specifically asked about conversion therapy and about whether LG is different than BTQ. So you, the Inner Circle members, know me, and you know the style that I like to approach questions with. I would like to start with the broadest possible picture and then slowly zoom in until we actually answer Rabbi Lipner's, or attempt to answer Rabbi Lipner's excellent question. There's been a political debate raging between the people who call themselves the essentialists and those who call themselves constructionists. Okay, essentialists view sexual orientation as an inborn property. Every person possesses a fixed sexual orientation, LGBTQ, heterosexual, etc. And at some point, the individual discovers and affirms this aspect of identity. Culture doesn't influence identity in the essentialist model. At most, culture can facilitate, constrain, or prohibit phenotypic expression of an individual's intrinsic sexual orientation. Those are the essentialists. Okay. In contrast, constructionists view sexual orientation as the product of culture, although many admit a hybrid in which culture interacts with biological inclinations. According to most constructionists, people are sexually fluid. They experience a wide range of fleeting sexual thoughts and desires throughout their lifetime. And then they interpret those urges in light of the identity categories or scripts available in their society. If the society fails to establish taboo roles or practices, then human sexual activity remains fluid. To the extent that a society sanctions only specific sexual identities, people learn to suppress taboo urges and indulge in permitted ones. In cultures that endorse the belief that every person is born into a fixed sexual orientation, then adolescents feel challenged to search and discover their one true identity. They may feel compelled to construct a personal narrative about their investigation and conclusion, weaving selected autobiographical facts into a coherent life story and proving to themselves and to others that they really possess this or that orientation. Or in the words of one of the great researchers in this area, Dr. Bertram Kohler, he's a professor of psychology at the University of Chicago, the remembered past is often not the actual past. One of the most published and cited academic scholars in gender studies, Professor Lisa Diamond from the University of Utah, explains it this way. She says, quote, individuals subtly and sometimes unconsciously revise descriptions of previous attractions and behaviors to conform to their current understanding of themselves. A woman who now identifies as lesbian might look back on previous pleasurable relationships with men and conclude that she was in denial about her lesbianism. The essentialists who believe in fixed sexual identities root their argument in studies done on Western culture. This is because many non-Western cultures deny the very existence of fixed categories of sexual identity. For example, extensive fieldwork on the Sambia of Papua New Guinea discovered a culture in which adolescent males are ritually launched into an extended period of homosexuality, followed by a transition in early adulthood to heterosexuality. Sambian males don't view themselves as categorically bisexual, homosexual, or heterosexual. They don't think in terms of identity categories at all. In their culture, people intermittently feel all sorts of sexual urges, but the practical focus of sexual activity evolves over time. Research in other cultures, such as Hong Kong and India, demonstrates that fixed homosexual orientation is a social construct of the West that only spread to these cultures with cultural globalization. Before Western culture arrived, most societies never conceived of human beings having any fixed sexual identity. Essentialists also root their argument in studies of modern societies, since there are virtually no ethnographic data suggesting the existence of sexual orientation as an immutable category even in the West prior to the 1800s. Almost without exception, pre-modern societies viewed sexuality as a fluid practice, not a fixed identity. Animal studies reinforce the case against fixed sexual orientation. Research on non-human primates reveals same-sex sexual behavior is widespread, though the observation of exclusive homosexuality has never been documented amongst animals. Okay. The holy grail of essentialist theory has been genetics, and there have been some successes. In July 1993, geneticist Dean Hamer published an article in Science identifying a potential genetic marker for homosexuality. In 2005, Dr. Brian Mustansky, a professor of medical social sciences at Northwestern University, published intriguing evidence for genetic transmission of homosexuality on 3 different chromosomes. However, fraternal and identical twin studies have variously established heritability of a homosexual trait as anywhere from 30% to 60%, never higher. Okay, for comparison, twin studies have found that heritability of smoking, which is a behavior that most people consider to be under conscious control and yet situationally influenced, is also about 60%. Similar estimates have been found for the heritability of marijuana and alcohol use. Even job satisfaction shows significant heritability, most likely because it's strongly related to personality. And it yields heritability estimates ranging from 45 to 60%. Okay, the media tends to trumpet biological efforts when it comes to homosexuality. But we are still waiting for the New York Times headline declaring, quote, "Born unsatisfied with your job." If it is ever verified, even 60% heritability would leave human sexuality enormously fluid. Okay, so how do essentialists navigate data suggesting people aren't born into fixed sexual orientation? What happens when this reality clashes with the claims that people are born gay, straight, or anything else? Actress Anne Hesh became the poster child for lesbianism in 1997 when she, quote unquote, came out and began her well-publicized relationship with Ellen DeGeneres. But then, in 2000, Hesh left DeGeneres for Coley LaFoon, a cameraman, working on DeGeneres' comedy tour. Hesh and LaFoon had a son, but then Hesh had an affair with her co-star, actor James Tupper, and became pregnant with Tupper's child, at which point LaFoon divorced Hesh after 5.5 years of marriage. Okay, if sexual orientation is fixed, then how did DeGeneres' lesbian partner for 3.5 years transition so enthusiastically back to heterosexuality? Professor Diamond cites essentialist writings explaining that these sorts of experiences of discontinuity signal, quote unquote, false consciousness, a misperception of one's authentic attraction and orientation, end quote. For 3+ years, Hesh mistakenly thought she was a lesbian and said so very publicly. But that was only Hesh's, quote unquote, false consciousness, not her true self. Okay, let's look at the other side. If the constructionists are right, and people are not hardwired for a fixed sexual orientation, how did so many Westerners become convinced that they were born locked into identities of straight, gay, lesbian, bisexual, transsexual, queer, or any of the other fixed categories that are now gaining popularity? Western culture presents adolescents with a neat matrix of sexual identities. Concurrent with exploring their nascent sexual feelings, young adults learn the options that are presented by our society. Since Western culture insists on fitting sexuality into neat, fixed boxes, our kids, Western youth, feel compelled to identify with a culturally familiar option. Dr. Philip Hammack, professor of psychology and director of the Sexual and Gender Diversity Laboratory at the University of California, Santa Cruz, describes this process as, quote, unique to our culture and historical time, in which a categorical system of identity possibilities is imposed on an underlying dimensional experience of far greater affective complexity. He continues, he says, hence, there exists the perception of a cultural press which motivates one to categorically self-label, end quote. If a teen feels even occasional sexual attraction to someone of the same sex, then today he or she feels compelled to uproot him or herself from the quote-unquote straight category and replant him or herself in LGBTQ or some other category. You've got to fit into the Western taxonomy someplace. Certainly, an individual's sexual feelings influence which fixed identity he or she assumes. However, many people experience a wide range of sexual urges. That's the point. There may be moments, weeks, months, or years when the male body is sexually interesting. And then there might be moments, weeks, months, or years when the female body is attractive. People may permit themselves to consciously experience all these sensations, or they may sublimate some of them. What factors compel people to censor or emphasize one desire or another? So obviously family values have some influence. So does religion. Without doubt, the values of the larger society also encourage or discourage assuming certain sexual orientations. The United States General Social Survey examines, among other things, Americans' sexual attitudes and sexual behavior. Between 1972 and the year 2014, the percentage of Americans who felt that same-sex sexual activity was, quote, not wrong at all, rose from 11% in 1972 to 49% in 2014. Against this groundswell of approval, the percentage who actually had sex with at least one other person of the same sex approximately doubled. But American culture isn't homogeneous. During the same period, the black community in America did not become more supportive of same-sex relationships. And without surprise, the frequency of same-sex behavior among blacks was also stable. Those of all races who attended religious services of any type were also less likely to engage in same-sex activities. The data reveal an even more pinpoint effect of one subculture's impact. Consider this. Same-sex behavior among female college students increased dramatically over time, but only until graduation. When they graduate from college, same-sex behavior dwindled. The impact of women's studies courses, of sororities, and probably myriad other elements of the university experience is enormous. But in many cases, we see it's temporal. It's fleeting. This phenomenon is so ubiquitous that it led researchers to coin the term BUG, B-U-G. It's an acronym for bisexual until graduation. It's used in academic circles. It's so common. What moved Americans to become more approving of same-sex relationships? So, political activism certainly has had some impact. After gay and lesbian activists stormed the 1970 and 1971 annual meetings of the American Psychiatric Association, its leadership made the famous decision to remove homosexuality from the DSM-2. Perhaps their decision had nothing to do with the fact their meetings were disturbed 2 years in a row. Perhaps it was connected. Since the Chicago Gay Liberation organized its first march in June 1970, there have been hundreds of gay pride parades and events. College and university courses are almost universally supportive of LGBTQ lifestyles. The media also has an enormous impact. Researchers at Southwestern University Department of Psychology discovered that those with LGBTQ plus sexual orientation often cite shows like Ellen DeGeneres, The L Word, Will and Grace, and queer as folk as having helped them realize that they were not heterosexual. These researchers reported, quote, beyond making participants feel comforted, gay, lesbian, bisexual role models in the media made study participants feel as though it was acceptable to be gay, lesbian, bisexual, end quote. Above all, the researchers found the internet and social media exert a powerful and pervasive influence on sexual identity. Political activism, academic courses, television, movies, internet, and social media are all educational. They're educational, and they have all contributed to the Western beliefs that sexual identity is fixed at birth, and that those who even transiently find people of the same sex sexually appealing cannot be heterosexual. Put simply, education can persuade people that they are born into fixed categories of sexual orientation, and it can change the fixed categories of sexual orientation people embrace. So this begs the question, this is really the question that our Inner Circle member asked. Why couldn't education shift people's sexual labeling in the opposite direction too, from LGBTQ plus to straight? Yet we're told that conversion therapy never works. The American Psychiatric Association fact sheet on reparative therapy opens with the following categorical statement. Quote, no scientific evidence exists to support the effectiveness of any of the conversion therapies that try to change sexual orientation. Okay. Like many positions of the APA, this one may be more rooted in politics than in research. An entire literature of peer-reviewed research demonstrates that sexual orientation conversion therapy has contributed to people changing their sexual label of choice, albeit usually only a minority of those who enter into conversion therapy identifying as LGBTQ plus ever graduate, quote unquote, from these programs identifying as heterosexual. What is true and horrifying is that many people who participated in conversion therapy suffered extreme psychological distress, depression, anxiety, or even attempted suicide. Pro-LGBTQ plus education conducted through political activism, academic courses, television, movies, internet, and social media don't toss people into depression, anxiety, and suicide. So why are pro-heterosexual conversion therapy programs so disastrously different? What is the difference between what the pro-LGBTQ education conducted through political activism in academic circles, the internet, etc.? Why is that so effective and not destructive, while the pro-heterosexual conversion therapy programs are so disastrously destructive? So I don't know if we know, but the answer might be in the methodology that's employed in most conversion therapy programs. Some of them use something called aversive stimulus to create negative associations with same-sex behavior. Okay, now this is horrifying, and it's difficult for me to describe this to you. These stimuli, these negative stimuli, include electric shocks, convulsion or nausea-inducing drugs. One peer-reviewed paper about conversion therapy, penned by 15 physicians, lists these ethical violations. These are things that are common in conversion therapy programs. Telling patients that homosexuality is a mental disorder because of practitioner beliefs when there is no evidence that this is the case. Breaches of confidentiality, that is, counselors in religious schools informing administration officials about a patient's sexual behavior discussed in therapy, sometimes leading to expulsion. Improper pressure placed on patients, like threatening to end treatment if the patients do not submit to the therapist's authority. Abandoning patients who eventually decide to come out as gay or lesbian. That is, unwillingness to refer a patient to a gay or lesbian affirmative therapist when conversion therapy fails. Indiscriminate use of treatment. That is, regardless of the probability of success, conversion therapists will recommend their treatments to anyone. When patients are not able to change their sexual orientation, conversion therapists often blame the patient rather than the therapy. This can lead to shameful internalizations that may induce or worsen depression. Those are all listed by these physicians, pointing out why conversion therapy drives people over the edge. However, and this is me speaking, most critics of conversion therapy miss what may be its greatest weakness. Conversion therapy, like the LGBTQ plus movements, buys into the essentialist belief that healthy people have fixed sexual identities and that a healthy heterosexual won't ever find someone of the same sex sexually appealing. The whole goal of conversion therapy is to move someone from one fixed category, LGBT or Q or something else, to another fixed category, straight. By rejecting the possibility of sexual fluidity, conversion therapy sets up many of its participants for feelings of failure or guilt. Okay, for a moment, I want to talk about the Torah position. The Torah accepts the fluid nature of human sexuality, recognizing that the very same person may experience a wide range of sexual urges and desires. Simultaneously, the Torah discourages acting on every urge or desire outside the sexual realm. The Torah forbids many behaviors, but the Torah pathologizes only a few of them. For example, Judaism declares that it's not pathological to want to wear garments containing a mixture of linen and wool, shatnez. It's not pathological to enjoy the taste of pork. It is not pathological to feel sexually attracted to forbidden relations. Yet the Torah does not permit any of these. In an astounding prescription, the Midrash teaches as follows. Consider this Midrash, it is astounding. Elazar ben Azariah Omer. Rabbi Elazar ben Azariah said, Minayin, where do we learn? Shelo yomar adam I afshi lilbo shatnez. A person should never say, I don't want to wear shatnez. I don't like shatnez. I afshi le'echol basar chazir. I don't like pork. I don't want to eat pork. I afshi levo ela erva. I don't have any desire to have relations with someone with whom it's forbidden to have relations. Where do we learn that a person should not say these things? Rather, aval afshi. A person should say, I desire all these things. Umaya said, but what can I do? Avi shebashamayim gazer laikach. My Father in heaven, He decreed on me. I'm not allowed to partake of any of these things. Where do I learn that I shouldn't say I don't like pork? I like it, but I'm not going to eat it because God said. Talmud Lomar, the pasuk says, the verse says, "Ve'avdil etchem min ha'amim liot li." I'm going to separate you from the other nations. Hashem says to be mine, to be for me. Nimtza, because it says that we're separated to be liot li for Hashem. We're supposed to be dedicated to Hashem. Nimtza, poresh min avera. We separate from these sins, from these forbidden behaviors. Umakabel lav ol malchut shamayim. And we accept upon ourselves that I'm not king, God is king. This is an astounding passage. A person should not say, I do not desire to wear shatnez, I do not desire to eat the flesh of a pig, I do not desire to cohabit with erva, illicit relations. I shouldn't say that. I do desire it, the Midrash says, but what can I do? My Father in heaven has decreed against it. Note, the Torah pathologizes unethical behavior, but not ritual violations. A spiritually healthy person hates cruelty, hates lying, hates theft. But there's nothing spiritually wrong with desiring non-kosher food, as long as you don't eat it. So too, there's no room for low self-esteem and no need for guilt if one desires erva, illicit relations, as long as one doesn't act upon it. Urges and desires are part of being human, Hashem is telling us. The Torah's message is that God is king. He makes the rules. And when we and God differ over what we prefer, God wins. Conversion therapy, as it's practiced in its worst forms, is a terrible idea. Aspects of it may even be forbidden by Torah law. But the reality of human sexual fluidity, combined with the impressive educational impact of political activism, academic courses, television, movies, internet, and social media, tell us that education could guide sexuality and give people the opportunity to live emotionally and sexually fulfilling lives consonant with the Torah. To answer your question, Rabbi Lipner, you're right. Education can move people from one sexual orientation to another sexual orientation, from one sort of sexual activity to another sort of sexual activity. What's the first step in chinuch, in the Torah's approach to education? Rashi famously defines genuine Jewish education, chinuch, in this way. He says, chinuch is lashon hatchalas knisas ha'adam okli. It is the beginning of the entry of a person or an instrument. L'umanus shehu atid la'amod ba. To the activity that he, the person, or it, the instrument, should perform in the future. It's the beginning of introducing a person or an instrument to the job it's going to be doing forever. That is called chinuch. According to the Torah, chinuch ideally happens at the launch. Beginnings deserve extraordinary attention. Okay. The same is going to be true when it comes to sexuality. One's earliest sexual experiences are enormously impactful. Okay. This is certainly true for the constructionists who believe that sexual identity isn't necessarily fixed from birth. And it may even be true for the essentialists who believe in genetic programming. Think about this concept. The University of Utah's Lisa Diamond writes, quote, this will blow your mind. Our brains are innately predisposed to assimilate a native language, whatever that language turns out to be. Once acquired, that language cannot be unacquired. It is as firmly fixed as if we were born with it. Some people have contended that certain environmental influences on sexuality operate in similar ways, quote unquote. Just as we acquire a language and we can't unacquire it, so too people can acquire a sexual orientation, and then it's very, very difficult, if not impossible, to unacquire it. In other words, just as no one is born with English as their language, but once exposed to it, English becomes an inalienable aspect of their consciousness, so too, if someone's earliest sexual experiences are heterosexual or homosexual, those identities could become inalienable aspects of consciousness. Okay. Diamond goes a step further. She also uses the metaphor of alcoholism. Even someone with a genetic predisposition to alcohol, that is, someone who's genetically predisposed to abuse alcohol, will not experience uncontrollable urges to drink until they've tasted alcohol for the first time. However, once someone who's genetically inclined to alcoholism experiences alcohol, a previously dormant predisposition kicks in and takes over. Rabbi Moshe Chalkowski, a master Jewish educator, once remarked to me about young women experimenting with same-sex intimacy. Quote, he said to me, once the genie is out of the bottle, it's pretty tough to get it back in. If the goal is to live happily, in harmony with the Torah, in harmony with what God said at Mount Sinai, the first step is going to be to steer clear of same-sex behavior from one's earliest youth, from the outset. Rabbi Tchaikovsky's mentor, Rav Shlomo Volba, gave this as one of the reasons why it's not a great idea to send our pubescent youth off to dorms. Okay, what about when the genie has already been set free? Then, learning about sexual fluidity, this concept that people experience lots of different drives, normal people experience lots of different drives in lots of different directions, just knowing that can be enormously liberating. If fixed categories of sexual identity are mythological, and normal people can feel attracted to both sexes, then those desires aren't any morally worse than wanting to wear shatnez or having a craving for a cheeseburger. And having those desires don't make you gay or bisexual or anything else. It certainly doesn't transform you into a bad or a sick person. You're a normal person with normal drives. Boker Tov, no problem. How do we behave? I don't wear shatnez, and I don't eat pig. Okay, let's take it a step further. What about people who currently feel attracted exclusively to same-sex partners, and yet they want to conduct their intimate life as heterosexuals? So, during the period when one feels exclusively same-sex attraction, the Torah discourages you marrying an opposite-sex partner. Out of concern for the partner's feelings, everyone wants to feel attracted to their spouse. Ve'ahavta l'recha kamocha, the Torah says, love thy neighbor as thyself. And the Talmud expounds, explaining that one, therefore, may not marry someone whom one isn't attracted to. Your spouse will notice. It's cruel to do such a thing. Okay, is there nothing someone can do to take control of their sexual interest? So, scientists distinguish between two types of sexual desire. One is called proceptivity, and the other is called arousability. There's proceptivity and arousability. What's the difference? Proceptivity is what you and I call lust, quote unquote, or libido. It's an internally generated sexual motivation. And it can happen even in the absence of any genuine relationship. With someone who I have no connection with, there can still be a sexual drive. We can suppress it, or we can tune into it, but we can't direct it. It's part of the base animal nature of every human being. If people are really sexually fluid, like the constructionists say, then a person who permits him or herself full conscious awareness of his or her drives could have perceptive interest in men for a period, then have perceptive interest in women for a period, then flip back to men, then flip back to women. Okay, that's proceptivity. It's hormones, it's driven, it's the most animalistic drive within a person. In contrast, arousability refers to a person's capacity to become aroused or to arouse him or herself by environmental triggers, cues, or situations. An attractive personality can trigger arousability. This is how people can start out with completely innocent platonic relationships with no sexual feelings and develop new and often unexpected sexual desires for that person as a result. The deeper the person and the more developed their relationship skills are, the more arousable they become. As people get to know the man or woman they're dating, the date's initially ordinary appearance can actually change. They can become breathtakingly attractive. If someone wants to take control of their orientation, they can do so by developing themselves and their ability to engage deeply in relationships. Okay, this won't negate the existence of proceptive drives, but it could shift a person's conscious focus towards arousable drives. Anne Hesh and a myriad of others like her experience exclusive attraction in one direction, and then exclusive attraction in the exact opposite direction. And many of these people claim it's because of the profound emotional connection they develop that generates this sexual interest. If we can learn to connect deeply, emotionally to somebody, then that can drive our sexual interest. The Torah possesses wisdom for deepening one's personality. The Torah offers spectacular technology, so to speak, for developing relationships. I've personally spoken for many, many hours publicly about the Torah's wisdom and how to develop relationships. You can hear those recordings for free on the web. I know that Simple to Remember has a bunch of them. The Torah explains how to develop yourself and to develop your arousability. This could be a path for taking control over one's sexual interest. So we've come full circle. And now I will try to offer a humble answer to your questions. You asked why conversion therapy is so harmful when we know that education moves people from one sexual interest to another sexual interest. We've seen it done in our society. So why is conversion therapy so bad? And the answer seems to be because conversion therapy so often is so abusive. And you asked if there are significant differences between LGBTQ and all the other varieties that are popping up today. And the answer is yes and no. All of these identities have in common that they are supposedly fixed congenital orientations. Anyone who calls themselves LGBT, they're all saying they have a fixed congenital orientation. But obviously, each is a different fixed orientation. Whether pre-programmed sexual orientations actually exist, as I described, is a subject of debate and scientifically very controversial. It's probably far more political than scientifically based. Okay, I hope, Rabbi Lipner, that answers your question. I hope this answers the question for other Inner Circle members. It's the pain and the frustration that so many people are experiencing in this generation is tragic. And the Torah's perspective is quite refreshing, that we pathologize ethical issues. But not all things the Torah forbids are ethical. There's also ritual prohibitions, and the Torah throws erva, forbidden relations, into a ma'amar chazal, a saying which is speaking exclusively of ritual violations. That's how we relate to it. Don't say, I'm not attracted to erva. Say, I'm attracted to it, but what can I do, my Father in heaven?
I hope you liked that answer from Rabbi Kelemen. If you'd like to listen to more questions and answers and ask your own questions, as well as listen to brand new material that Rabbi Kelemen is producing right now, check it out at LawrenceKelemen.com. You put in your name and email address, and we'll send you free lectures from all the new material Rabbi Kelemen has been publishing.